This is Dr. Ty Vincent, one of our LDI educational videos. This one is about the potential risks of LDI, low-dose immunotherapy. There are people who have some very valid concerns based on what they hear about the treatment, and I just want to dispel some of those. And then there are some people who persist in having some completely invalid fears about the treatment, and it's hard to convince those people of anything, but here goes. So, low-dose immunotherapy manipulates the hypersensitivity sort of aspect of the immune system response, which may not make sense to you, but think about it in terms of allergy. So if you're allergic to something, you're having an inappropriate reaction to that thing, right, that isn't necessary, okay? Let's think of corn, for example. It's a common one. Corn's not attacking you. Corn is not in any way harmful to you. If you have an allergy to corn, it's a totally inappropriate, ridiculous immune response to corn. So what we can do is we can restore tolerance to corn. We can eliminate that inappropriate hypersensitivity reaction to corn, right? By modulating how the immune system is responding to that thing. When we do that, we give you a diluted amount of actual corn, right? One thing people always worry about is, well, can't I react to the dose itself? It has corn in it. The thing is, it's been so far diluted that there's actually not really physical corn in it, not to the extent that your immune system cells could see it. So there isn't a molecular cellular interaction taking place when you take an LDI dose. It's just the energetic signature or signal of corn. So all we can do is we can alter, manipulate your immune system's reaction to that thing, whether it's Borrelia bacteria, Candida yeast, Epstein-Barr virus, corn, dog dander, your husband's semen, whatever we decide we're going to dilute and use to try to desensitize you to something inappropriate, right? So what we can see happen is we can make that reaction you have already somewhat worse, okay? If we give you too strong of a dilution and the signal intensity is too strong in that sense, then your reaction to corn or dog dander or whatever can intensify. So like if you normally eat corn and you get nauseated and a stomach ache for a couple of hours, if we give you too strong of a corn dilution, you might, next time you eat corn as a test, you might throw up and have really intense stomach pain and then diarrhea all day long. Maybe that would happen, okay? That's kind of a ramping up of the same sort of reaction pattern. But what you're not going to get is something totally new. So you're not going to start bleeding from your eyes, have a migraine headache, have arthritis, or hives, or some anaphylactic reaction to corn, because you've never had that before. So we can turn up existing reaction patterns. We're not going to cause new ones, okay? If you have a Lyme disease sort of pattern, and your Lyme symptoms involve fatigue, brain fog, joint pain, that kind of thing, you're not suddenly going to develop peripheral neuropathy, like burning, searing pain in your legs and feet, if you've never had it before. Okay, you're not going to get a new symptom. That's just not really what happens. So that's one thing people worry about. Well, you're going to give me this new thing. You're going to give me a disease I don't already have. No, we're just going to modulate the disease you do have. Another thing is we're not going to make you sensitive to a new thing. So that's really true when we deal with the food mixture. Somebody who's only allergic to corn, let's say, but we give them the food mixture that has more than 200 individual food items in it. There's no possible chance that we're going to cause you to develop a peanut allergy or a beef allergy or a carrot allergy just because those foods are in there. Because the foods themselves are not in there, right? So if you don't develop an allergy by eating carrots themselves, eating beef itself, how on earth would you develop an allergy by getting a homeopathic dilution of that thing that doesn't even have that thing in it in a physical sense? It doesn't make any sense. And yet that's out there on the internet. This is on the internet too, and I would say blanketly you can't necessarily believe everything you read or see or hear on the internet, which is true. But I've actually used this therapy with thousands of people for more than a decade, so I know a little bit more than most of the people on the internet about it. But yeah, you're not going to give somebody a new allergy. You're not going to cause a whole new disease. The people that are out there who are talking about how they took a single LDA or LDI dose and then they developed all these new problems are almost always incorrect about what happened to them. And that the dose they took was responsible. Case by case, we'd have to go through it, but that's usually what's going on. What else? Oh, we use a lot of organisms, right? So like the lime mixture, for example, this is one where this commonly comes up. It has a mixture of Borrelia, Bartonella, Babesia, Ehrlichia, all these different bacteria in there, right? And people worry, well, are you going to give me an infection with those things? I don't want to take that dose. It's got those bugs in it. And the issue with that is that, number one, they're dead. So the organisms are killed by electron beam irradiation. Their DNA has been destroyed. They're inert. They're just proteins, basically. We're using it as an antigen, but there is no living agent in there. So there's absolutely no chance of causing an infection because that reason alone. And again, also, when we use a lot of our typical LDI dilutions, there really aren't many organisms to come in contact with in the first place because it's so diluted. If you get out past 12C of a dilution, technically there may not be even a single actual organism in there or a single protein of any kind, just water and energy signature. You know, in a literal sense, that can't be true. They didn't disappear into the ether. Those molecules are here and there somewhere, but any given dose that you take statistically may not have any particles in it, okay? Just water and plastic and whatever's in the plastic of the syringe. So there's that. The other thing is, presumably, we're giving you something you already have in your body, right? Like if you know you've had shingles, for example, you've had chickenpox and you've had shingles, and we give you the varicella LDI, that's the virus that causes chickenpox and then shingles, you know, you already have that virus in your body, right? So we're not going to give you something you didn't have in the first place. If you have herpes, when we give you the herpes, you know, simplex mixture, you already have the virus. I bring up the viruses because the only things that we use with LDI that were living, which is a loose interpretation of the word living, were some of the viral vaccines. So the varicella vaccine, the flu vaccine, the MMR, measles, mumps, rubella, those are all live attenuated viruses in the vaccine to begin with. And then we take that and we dilute it way out. So theoretically, there's an occasional random live virus particle that might be in a dose that you take. But those are given to people as vaccines with full strength loads of virus to people. And so giving somebody an LDI dose with that is incredibly weaker and more diluted. Even if you did encounter an occasional virion, you know, that's viable in there, it's not going to do anything. It's pretty inconceivable. And they're attenuated, supposed to be safe, says the vaccine manufacturers. But that's the one thing where there was something alive in there to start with. And so if you really are super concerned about that, you don't want us to risk like a single particle of influenza, you know, virus ever entering your body. Then you better live in a bubble, number one, because you're going to probably encounter it every winter. But, you know, don't use that LDI, I guess. Those are the three that have, you know, viable things in them to start with, at least. What else? As far as what people are worried about, can you give me a new disease? No. Can you give me an infection? No. Can you give me symptoms I didn't have before? No. You know, so, and those are pretty much solid, you know, facts and expectations. So when I've had a number of people who take an LDI dose and then they develop like what sounds like an acute viral illness afterwards, which could happen to anyone any given day. It just will coincidentally happen after you take an LDI dose sometimes because that's part of your life. And then they want to link the two just because of timing and association. And that's human nature to do that. But it isn't valid. It's a totally different set of symptoms, right? So if we're treating you for irritable bowel syndrome and you take a dose of the yeast LDI and then you develop a fever and a cough and, you know, difficulty breathing, we didn't do that with the yeast LDI. Number one, those aren't symptoms you're ever going to see with the yeast LDI. And number two, those aren't the symptoms that we're even looking at in the first place, right? So try not to make that connection just based on coincidence. Coincidences happen all the time. It's really annoying. It's frustrating. You know, we'll treat people who have asthma or in respiratory allergies with the environmental mixture, and then they'll get a cold the day after they take the dose. And the symptoms are very similar, and it can be very confusing. And that happens. And whenever there's the chance that something we didn't want to happen may have happened, we have to just wait 7 weeks and back up to a different dose. And then we often get right back to where we started and nothing happens the next time. And then we go, okay, well, we know now, with more experience, that what happened before was not related to the dose. But sometimes you just want to play it safe. And I think that's about it for the common concerns about what are the risks of LDI. But, keep throwing questions our way, and we will keep trying to put out answers for people. It's the best we can do.